North Carolina is taking a new approach to fighting gun violence. The health department has declared it a public health crisis. Today is November 17th, and new numbers from the state show statistically 85 people have died from gun-related injuries this month. That means 5 people are dying every day. WRAL's Adam Owens joins us now live with how the state plans to keep people alive. Adam?
Yeah, Deborah, those numbers are extremely sobering, but many times when we have discussions about what to do about gun violence, it never quite gets past the politics. Well, state officials have some new suggestions that they believe may start with a place that everyone can agree. 5 people were killed in a mass shooting in Raleigh. Governor Roy Cooper remembers meeting with the victims' families and offering condolences.
They wanted more. They were angry. They wanted justice, and they wanted to keep it from happening again.
Cooper brought law enforcement and other experts together to talk about solutions to gun injuries and deaths. The first hurdle, as it has been for years, will be political.
We respect the Second Amendment. We respect our right to own a gun, just like we respect our right to drive a car. It just has to be safer.
Adam, this is why we wanted to start in a space where we have consensus.
Health and Human Services Secretary Cody Kinsley believes a good starting place is in this report, approaching the problem like a public health issue.
First and foremost, we have to follow the data.
That includes looking at who is most affected by gun violence and trying to figure out what led up to it to attack the source of the issue. According to the state, more than half of gun-related deaths are suicide.
We've seen a tripling in reports of anxiety and depression through COVID compared to the prior years.
Our kids are also getting hurt. 116 children in North Carolina died of a gun-related injury last year. Dr. Brian Eichner is a Duke Children's primary care pediatrician.
And it's really heartbreaking to know that there's all these things that are preventable that still happen to kids. As you might know, guns became the leading cause of death in young people as of last year.
And that is why this report we're talking about here, Deborah, suggests more education on storing guns, strengthening protective orders, and another suggestion from the governor and his administration, expanding Medicaid in North Carolina. That they believe that would make mental health help more accessible to more people in this state. Deborah.
Adam Owens live in Raleigh. Thanks, Adam.